Healthcare costs in the United States surpassed $2.3 trillion in 2008, more than any other country in the world. U.S. standing in international health rankings continues to decline. Within the United States, Tennessee ranks 46th in life expectancy, 44th in infant mortality, 48th in obesity, and 45th in preventable hospitalizations. In 2004, Tennesseans spent more than $32 billion on medical care. Why do we spend so much and get so little?
Major funding for NPT Reports, Children's Health Crisis, is provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the Monroe Carroll Jr. Children's Hospital at Vanderbilt, where discovery brings hope, Vanderbilt University School of Medicine, Department of Pediatrics, Baptist Healing Trust, fostering access to compassionate health care in Middle Tennessee. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.
Hi, I'm Kimberly Williams-Paisley. If what we're doing now isn't improving our children's health, then what can we do as parents, as healthcare providers, and as a community to ensure our children will have their best shot at a long and healthy life? Join me for this edition of NPT Reports Children's Health Crisis as we explore a broader picture of health that goes beyond healthcare. Stay tuned.
My first experience when I had to take Jordan to the emergency room with an asthma attack, you could tell he was struggling and he started to sweat really, really bad. I had called the pediatrician and she had told me to just go to the hospital. We got back in the room and they started putting all this tape and wires on it, and I'm like, oh my goodness, what's going on? Looking at a child that young, they can't talk, they can't tell you what's going on, what hurts. As a parent, it hurts really, really bad because there's nothing you can do. You don't know where to hold them, where to rub, what needs fixing, and it's just a guessing game. And when you get to the hospital, it's the same way. You're helpless, just like the child. You don't know what to do.
Yeah, she's pretty tight, Mom.
In the last 25 years, childhood asthma, like obesity and diabetes, is on the rise in the United States.
And right here, that means that their lungs are pretty clamped down and tight.
Today, asthma is the most common chronic disease in children, a leading reason children are absent from school, and the most common cause for hospitalization in children.
Can I listen right here? Good job.
Asthma is primarily an inherited and environmental disease.
Perfect.
We cannot prevent a child from getting asthma.
Here we go.
We'll never be able to prevent all acute asthma attacks, and that's one of the reasons we are here as an emergency department.
There, good girl.
But we think we could probably prevent about 90% of the visits to emergency departments by good preventive care.
Successful prevention of asthma means controlling the causes of flare-ups before they can lead to an attack.
At the time that we were able to go home, the doctors come in, they kind of ask, what is the environment like at home? They try to help you figure out what may have triggered the asthma attacks. I had no idea, no idea. I have two sons that have asthma. I have an 11-year-old and a 6-year-old. My 11-year-old son's asthma is pretty much under control. He flares up maybe 2 or 3 times out of a year, and it's normally the weather outside versus my 6-year-old. This last hospital visit we had, I think they said this was his 11th time for 2010 of being in the hospital with his asthma.
Our current system of health care tends to be episodic care. We fix things when they're broken. We don't address things sufficiently before they're broken to prevent that. Asthma is the perfect example of a disease process in which if we intervene in simple ways
hard. Go, 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 go.
to prevent acute episodes, we can avoid those more severe episodes that are very expensive
Good job.
to the child, to our economy, and as a public health burden.
Moving from medical intervention to prevention of illness and injury in the first place may mean changing the way Americans understand health.
We look at health as something we deal with after people get sick or after people get injured, yet we know that most of the determinants of people's ultimate health have much more to do with what we do in the community in the first place. The research shows very clearly that medical care, surprisingly, is maybe 10 or 15% of the determinant of how healthy anyone is going to be. Genetics is another important piece. But the largest percentage of determinants of health has to do with our individual behaviors and the environment. I need to be very clear from the beginning that the environment, in fact, shapes our behavior. You could say that the environment is the tipping factor which determines whether someone gets sick in the first place.
Medical care may only determine 10% of an individual's health, but healthcare providers still have a role to play in prevention.
If you look through medical history, the most cost-effective and medically effective things that we can do as healthcare people is to prevent disease. It's much easier to prevent things than wait until the disease is already happening, and that's what vaccines do. They prevent you ever having a disease.
A child's first vaccine is scheduled within 24 hours of birth. In 2010, Tennessee had the highest childhood immunization rate in the United States. Children are required by law to get certain vaccines for preschool, child care, and school.
This way, if she should ever have...
Pediatricians have often used vaccines as a seed to have a visit, but also to discuss greater health issues. So I think we benefit from those visits even beyond the vaccines.
We do something, what I think is really important, is called anticipatory guidance, and that's sort of what to expect next. And so when you come in with your 6-month-old, we're talking about, well, your baby's sitting up now, they're probably rolling over, we're starting to transition to solid foods. But in my mind, what's really important is we're going to talk about in the next 3 months, you're going to start baby-proofing your house. Make sure that your outlets are covered and that you don't have cords hanging down and your cabinets are locked. Once you hit about 15 months or 2 years, you're pretty much done with your major immunizations, and then it's like it falls off a cliff, and we don't see those kids unless they're sick.
Open your mouth really wide for me.
The number of children in the U.S. who see their primary care provider for well child visits continues to decline with age, from nearly 90% with a visit at age 1 to only 35% by age 13.
So I think there is this sort of hyper-acuteness that when kids are really little, we really focus on every single pound that they gain, every new word that they say, every sort of milestone they meet. As kids get older, I think we naturally fall into this, well, they're generally pretty healthy. Things must be going okay. And we forget the bigger picture. The well child visit is like the 20,000 or 30,000 mile tune-up on your car. It's running those diagnostics. Where are we now? What are the pitfalls that we can predict based on what we're seeing? And how can we help you avoid those? And so if we miss those opportunities, that's one less opportunity to really steer that child, that adolescent, that young adult in a direction toward a healthy, long life.
Well, in a way, we've been spoiled with vaccines. They work so well. You get them maybe 1 to 3 doses, and you're protected for 10 or 20 years, maybe your whole life. There was this renaissance of understanding viruses and bacteria in the early 60s. A lot of vaccines were made, and we've been chipping away, adding a vaccine every few years since then. But most of the easy stuff is done. Maybe we've been sort of tricked into thinking everything ought to be that easy. Now we're left with harder infections or harder health problems.
Today's medical care system is not designed to deal with the health problems driving high cost and poor outcomes in Tennessee and the United States.
We have a healthcare system today that's still rooted in what healthcare was in the 20s and 30s of the last century. You get an illness, you get sick, the doctor does something for you, you either die or get better. And that's just not the way it is anymore. A huge piece of the problem in healthcare today are these chronic diseases, lifestyle choices, your weight, your exercise, whether you smoke or not, what you eat, ultimately are now the limiting factors in your health.
I'm 10, I'm in 5th grade, and I like to play sports.
Go, 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 go!
I like to play volleyball and softball, and I'm gonna play soccer this year.
Kind of listen to your heart.
It started with her routine yearly visit at the pediatrician.
Why don't you get those shoes off for me and then stand on that scale?
And they were monitoring her weight, and then I would say in the last couple of years, they noticed that it was continuing to go up. And so they referred us to Vanderbilt.
Obesity is one of the most common and damaging risk factors for chronic disease.
All right, you ready? Let's go do our walk.
For children like Faith, at risk for obesity now, early intervention is crucial.
When I see a 5-year-old kid for obesity, I honestly not need to see the 5-year-old kid. I need to spend the time with the mom and the dad.
Come on, buddy.
If you make 2 or 3 small little changes, you're going to be fine. That's very different from the 15-year-old who has been watching 3 or 4 hours of TV since he was 5. The family's entrenched in kind of this is how we eat and this is how we operate. You know that if you're a preschool child, you have about a 20 to 30% chance of being overweight as an adult, but if you're overweight in your teens, you have about an 80% chance of staying that way.
Chronic diseases are set in motion in childhood and early adulthood, but they take years to actually flower into an overt disease. Chronic disease is the leading contributor to our high health care costs. The major chronic diseases are heart disease and stroke, cancer, diabetes. And what we know about these diseases is they are largely caused by a small number of very common, very damaging health behaviors. These include tobacco use, poor nutrition, low levels of physical activity, and excessive alcohol use. And all of these behaviors are modifiable.
Poor health in childhood carries over into adulthood, with consequences for the community. Those consequences are well known at Nissan North America, headquartered in Franklin, Tennessee.
We're a car company. We build cars and trucks. We're not a healthcare company, but we're being forced to become a healthcare company. If you look at the global landscape, just in the last 10 years, the global competitiveness has just escalated and it continues to accelerate. When we talk about labor cost, healthcare is one of those big items for the U.S., but it's not for the other countries. It really stands out, and we get a lot of questions. Well, why is it so high in the U.S.? I thought U.S. was a healthy part of the world. And in reality, it's very costly for us to provide this benefit for employees.
Nissan North America's health benefits are self-funded. While the corporation's medical costs grew, the health of employees did not improve.
Before, we provided great care. If you got sick, we had a great network for you. We made sure that you had all the coverage that you need, and there was just not a real focus on making sure that the well people stayed well. Now we're fundamentally shifting. We're moving our focus on wellness as opposed to just simply treating the illness. That sounds rather simple, but when you really put that into practice, that changes where you're spending your money, where you're investing.
The daily decisions driving health are a mixture of individual choice and environmental influence. In Nissan's community, everyone has access to resources and is employed. Across Tennessee, healthy choices are accessible for some families, but not for others.
If you think about chronic disease and you think about what we do as individuals, most people are working very, very hard to take care of themselves, to take care of their families. We're trying to be physically active. We're trying to select the right foods and eat healthier foods and watch what we eat. And yet, sometimes it feels like we're just climbing uphill because we're living in communities or in environments where that's very, very difficult.
The prevalence of obesity and chronic diseases in certain communities reflects inequities that exist across Tennessee and the United States. Socioeconomic status, race and ethnicity, where someone lives and their education, all determine health status.
We know that where a child is born in America, what state they're born in, what community they're born in, really determines their life expectancy. And in a country as rich as ours, where you're born shouldn't determine your life expectancy.
In our society, we have a lot of health disparities. They're mostly based on income. If you're poor, you're going to have a lower standard of health. You're going to be unhealthier. If you're wealthy, you have access, obviously, to more education. You have access to better jobs. You have access to healthier food. You have access to healthier neighborhoods. Everything about wealth can buy you a great deal more health. This is why the South is the unhealthiest region in America. It's also the poorest region in America. It's where we have the poorest and the most poor people of any region in America.
In the U.S., children below the federal poverty level are more likely to have asthma than children who are not poor. African American children are more than twice as likely as white children to end up in the emergency room with an asthma attack.
When managing asthma, it can get very expensive. When he's in a hospital 3 or 4 days and then he has to stay home 2 days before he can go back to school, I'm out of work 6 or 7 days between the 2-week pay period just because I have to stay home and care for my child. I use up my sick time so fast at work. So the hospital bills, they're just stacking up, going into collection agencies. I can only do so much with a short pay stub and a large bill to pay for.
Both of Alana's children have access to health insurance and cheaper medications through TennCare. But even with those benefits, medications can still be out of reach.
The inhalers, which are $20 a while. Then you have to buy more than one inhaler, not only at grandparents' house and at home, but also at school. Do it one more time.
Alana has a better understanding of what triggers her children's asthma attacks, but she can't always control their home environment.
You did 260. I lived in an older apartment when Jordan was a baby, and I know sometimes I could smell smoke through the vents from the other neighbors. And I know I would call the manager and, ask if they had changed the filters in my air conditioning and heating unit because I know these were triggers for the asthma. Then they started telling me because I had to get it changed so often that I would have to do it myself. And I'm like, I can't afford the things I'm doing now.
When you think about children, we want healthy environments where children live, where they go to school, and where they play. And the challenges are that sometimes we have great barriers in place, and we need to think broadly about those things that affect health. Policy interventions provide stickiness factors that really can influence the health of a child.
We have to, as a state and as an agency, look at policies that support families succeeding from the very beginning. That means helping families have healthy babies that start at a healthy birth weight, helping families breastfeed, because breastfeeding is associated with reduced risk of obesity and many other health outcomes, so that we can start children out healthy and establishing healthy routines and healthy lifestyles so they have better opportunities to grow into healthy adults.
Tennessee has successfully used policy to shape individual behavior and improve public health.
Oh, there used to be such a smoky haze at Legislative Plaza. And
I would joke about it, but in retrospect, it was pretty serious.
Until 2006, Tennessee legislators on Capitol Hill could smoke in Legislative Plaza.
I remember my astonishment the first day that I walked in to seeing powerful political leaders sitting in their committee chairs and smoking while they debated legislative issues. And that was astonishing to me at first, and then I very quickly became accustomed to it as the norm.
30 years ago in Tennessee, you would have seen lots of young people smoking, and you wouldn't have seen much of an uproar about that. You would have gone in restaurants, you've gone in other public buildings and seen cigarette smoke. People who have never smoked a single cigarette have adverse health consequences from secondhand smoke.
More than 40% of children admitted to the emergency room for an asthma attack have been exposed to secondhand smoke. In 2007, Tennessee passed the Non-Smoker Protection Act, which eliminated smoking in public places statewide.
Tobacco is one of the 3 items on our state seal, for goodness sake. And we were the first southern tobacco growing state to pass a statewide ban like this.
Though still above the national average, Tennessee's adult and child smoking rates have declined since passage of the Non-Smoker Protection Act.
So we've absolutely created a culture where we know that tobacco is bad, both for the people who smoke and both for the people who have never smoked.
A lot of it's just a cultural change. I think smoking is actually a good example of the kind of thing that's going to have to happen with obesity.
Preventing obesity and chronic diseases like heart disease and diabetes means addressing the health of children before unhealthy habits take root. The easiest place to do that is in schools, where you can impact the most children for the most time.
In schools, we can provide nutritious foods, we can provide smoke-free environments, we can provide opportunities for physical activity. We can model and establish healthful behaviors that children can take over the course of their lifespan. So schools are very important. They're sort of microcosms in terms of promoting healthful behaviors.
Tennessee legislators have made schools a healthier place for children, requiring 90 minutes of physical education every week for students in kindergarten through 12th grade. Tennessee also has banned sodas and sugary snacks in elementary and middle school vending.
School is the best place to address health problems. It is a way to truly reach the most amount of kids in the state of Tennessee all at one time. The reality is that children that are in elementary school today, if you're born in 2003, that's the very first generation. If something's not done about our child obesity rate, they're not going to outlive their parents.
Boys and girls, right now we're doing our garden journal.
Research shows healthy children do better in school, healthy children grow up to become healthy adults.
You know, these gardens are organic, which means
there is also a direct link between physical activity and academic performance.
Have a seat right here on this table for me, please.
In 2006, Tennessee became the first state in the U.S. to implement coordinated school health in every school district statewide. The Centers for Disease Control and Prevention developed coordinated school health to address the emotional, mental, and physical health of students. A coordinator in every school district evaluates the needs of each school, connects resources, and collects data on health trends. In rural Northwest Tennessee, the CDC is evaluating the efforts of Gibson County Special School District as one of 3 examples nationwide of coordinated school health.
Basically, what we're trying to do is to affect change in the life of a child 7 hours a day.
I have for you some food.
In a coordinated school health program, and in Gibson County in particular, you have comprehensive health education, nutrition education.
Which ones do we need the most of?
We incorporate all these healthy messages in every part of the day, and then try and make the link between your choices and how they affect you.
What I want us to do now is go ahead and do our Take 10 break.
It's very satisfying to see changes in schools.
And we're going to spell it as we twist. Ready? S.
To walk by a classroom and see a Take 10 lesson, which is physical activity in the classroom.
Very good.
In their selection, in their improved offerings in their cafeteria. Now those are the sort of things that you look for in schools, that you know this is working here.
as a result of us being the only state with coordinated school health as law. All other states are watching us right now. What we do is very challenging. We're trying to change a culture. So if we look at the state of Tennessee, we are the only state that's not only seen a leveling off of our childhood obesity rate since coordinated school health, we're actually seeing an almost 2% decrease, and that's huge. That is something definitely to celebrate. We just need to make sure that continues.
If we're going to improve health, we've got to move away from this. You get sick, you go to the doctor, you get a pill, you get well, into something which is much more preventive.
We need to look at how we can reconfigure our society, our environments, our policies, our priorities, so that we're designed for health.
Tennessee really can become one of the healthiest states in the nation, and it's going to take work. But what I would say is start where you are, because a commitment to your health soon spills over into a commitment to your child's health or your family's health, and will only lead to better health for your community.
It should be easy for our children to get plenty of exercise, find healthy foods, access quality preventive care, and understand the consequences of an unhealthy lifestyle. But creating a Tennessee where these healthy choices are a part of daily life may not be a quick or easy solution. If we succeed, and we must, we will secure a happier, more prosperous future for our children and for generations to come. Please join me in learning more about the children's health crisis in Tennessee and what you can do about it by tuning into NPT's ongoing coverage and by going to wnpt.net/children's health.
Major funding for NPT Reports, Children's Health Crisis, has been provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the Monroe Carroll Jr. Children's Hospital at Vanderbilt, where discovery brings hope, Vanderbilt University School of Medicine, Department of Pediatrics, Baptist Healing Trust, fostering access to compassionate health care in Middle Tennessee. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.